The bile duct cluster. Yellow eyes or skin, dark urine, pale stools, itching. If you remember one thing from this video, remember this cluster, what it looks like. You notice your urine looks unusually dark, like strong tea. Then your stool looks lighter than normal, almost clay-colored. Your skin starts itching, but there's no rash. And maybe someone says your eyes look a little yellow. Why it matters. All of this can point to one issue. Bile isn't draining normally. Bile helps color stool. If it can't reach the intestine, stool loses its color. Bilirubin builds up, and that can show up as yellow eyes, dark urine, and itching. In pancreatic cancer, this can happen when a tumor, often in the head of the pancreas, presses on the bile duct. Why people miss it? Because each piece has an easy excuse. Dark urine? I didn't drink enough water. Itching? Probably allergies. Pale stool? Something I ate. And the yellowing can be subtle at first. Also, people wait for pain. But early on, this can be painless. What to do next? If you notice yellowing, especially with dark urine, pale stool, or itching, don't watch it for a week. This is a get evaluated promptly situation. Clinicians usually start with an exam and liver blood tests, then decide what imaging makes sense. The goal isn't to assume cancer. The goal is to find the cause quickly, whatever it is. Upper belly discomfort that wraps into the back. A deep ache that doesn't behave like normal back pain. This is where people often treat the back, while the problem isn't the back. What it looks like. A dull pressure or deep ache in the upper abdomen, sometimes central, sometimes slightly to one side, and it can radiate into the back. Some people say it feels worse lying flat, and a bit better leaning forward. Why it matters. The pancreas sits deep in the abdomen near major nerve networks, so pancreatic problems can create pain that feels like it's coming from the back, even when it isn't. With pancreatic cancer, pain may show up later than people expect, but when it does, it can be persistent, deep, and hard to ignore. Why people miss it? Because back pain is everywhere. People blame posture, the gym, the mattress, stress, long workdays. Upper abdominal discomfort gets labeled reflux or gastritis. The danger pattern is new, persistent pain that doesn't match your usual aches, especially if it shows up alongside appetite change, weight loss, or new digestive issues. What to do next? If pain is severe or rapidly worsening, urgent evaluation. If it's mild but keeps returning, the next step is a real medical review. Be ready to describe the pattern. Where is it exactly? Does it wake you up? Is it tied to meals? Does it radiate to the back? Those details guide what comes next. Labs, ultrasound, CT, or other imaging, based on the full picture. Unintentional weight loss or reduced appetite. I'm not trying to lose weight, it's just happening. Weight loss can look like good news until you realize you didn't earn it. What it looks like. You're losing weight without changing diet or activity. Food feels less appealing. You get full faster than normal. Your clothes fit differently, and you can't explain it. Why it matters. Unintentional weight loss is a body-wide signal. In pancreatic cancer, weight loss can reflect reduced intake, metabolic changes, and impaired digestion. It isn't specific. Many conditions can cause it, but it's important because people often ignore it until it becomes dramatic. Why people miss it. Some people celebrate it at first. Others assume it's stress. Many think, if it were serious, I'd feel worse. But weight loss can be an early clue that something is shifting internally, especially when paired with fatigue, persistent GI symptoms, or new pain. What to do next? Track the trend, not the vibe. If weight is dropping without a deliberate plan, bring it up early. Clinicians usually start with basics, history, exam, and labs, then decide what needs deeper evaluation. The biggest mistake is delaying because it feels non-specific. New diabetes after 50, or diabetes that suddenly gets harder to control. My numbers changed, and I didn't change. Sometimes the pancreas sends a signal through blood sugar before it sends pain. What it looks like. You're diagnosed with type 2 diabetes later in life, out of nowhere. Or you already have diabetes, but sugar control suddenly becomes harder with the same routine. Why it matters. The pancreas helps regulate insulin. There's a known association between pancreatic cancer and recent onset diabetes, or sudden worsening control. Not as a diagnosis, but as a warning sign when it shows up alongside other changes like weight loss, persistent pain, or digestive symptoms. Why people miss it? Because diabetes is common, so people assume it's purely lifestyle or aging, and often it is. The missed moment is when diabetes changes plus something else is off. Weight loss, upper belly/back pain, unusual stool changes, or the bile duct cluster. What to do next? If you're newly diagnosed after 50, treat the diabetes seriously and ask one extra question. Do I have other warning signs I'm ignoring? If diabetes is new and you also have weight loss, persistent pain, or jaundice-related changes, that combination deserves a more careful workup. That isn't panic, that's pattern recognition. Greasy, floating, foul-smelling stools. Fat malabsorption that people don't want to talk about. This symptom isn't gross, it's information. What it looks like: stool that floats, looks oily, smells unusually strong, and can be hard to flush. Sometimes it's paired with diarrhea, bloating, or cramping. Why it matters. The pancreas makes enzymes that help digest fat and protein. If those enzymes aren't reaching the gut properly, fat digestion suffers. That can cause greasy stools and can contribute to weight loss and vitamin deficiencies over time. Why people miss it? Because it's awkward. People assume it's something I ate or a random stomach bug. But persistent stool changes are useful clinical data. They're not just weird details. What to do next? If the pattern is new and persistent, say it plainly to your clinician. Don't self-treat for months with random supplements and probiotics. A clinician can evaluate for malabsorption, enzyme issues, and other causes. The goal isn't to jump to cancer. The goal is to explain a real, repeatable change. Persistent indigestion, nausea, bloating, or early fullness. The background noise symptom that can hide real problems. When indigestion becomes a lifestyle, it stops being just indigestion. What it looks like: you feel full quickly, you get frequent nausea, you're bloated after small meals. Reflux or indigestion becomes persistent or progressively worse. Why it matters. These symptoms are common and usually benign, but they're also easy to normalize, and that's what makes them dangerous as a disguise. In pancreatic cancer, digestive symptoms can show up as appetite drop, nausea, or ongoing discomfort. Why people miss it? Because the first move is always over-the-counter meds, and if symptoms persist, people upgrade the antacid instead of upgrading the evaluation. The risk rises when this comes with weight loss, persistent pain, or new diabetes. What to do next? If symptoms are new, persistent, and not responding like your usual indigestion, especially with weight loss, get checked. Most of the time, it won't be cancer, but if it's something serious, earlier evaluation gives you more options. Calm medicine still needs timely action. Blood clots without a clear trigger. A weird clot can be a big clue. A clot isn't just a clot. Sometimes it's a signal. What it looks like: one-sided leg swelling and pain, like a tight, tender calf, or sudden shortness of breath with chest pain that worsens when you breathe in. Sometimes a clot is found incidentally during other testing. Why it matters. Some cancers can increase the tendency to clot, and clots are dangerous by themselves, especially if they travel to the lungs. When a clot is unprovoked, clinicians often broaden the search for underlying causes. Why people miss it. People mistake DVT pain for a pulled muscle, or they ignore swelling until it's obvious. And if a clot happens after a flight or surgery, people stop thinking once it's treated, even if the trigger didn't fully explain it. What to do next? Clot symptoms are not wait and see. If you suspect DVT or pulmonary embolism, seek urgent care. And if you've had an unprovoked clot, follow through on the evaluation plan. Don't let it become a one-and-done episode. Fatigue that doesn't match your life. Not, I'm tired, more like, my battery won't charge. When rest doesn't recharge you, your body is trying to tell you something. What it looks like. You feel drained day after day. Tasks feel heavier. Your stamina is clearly lower. Rest doesn't fix it. Why it matters. Fatigue is nonspecific, but common in serious illness. In pancreatic cancer, fatigue can reflect inflammation, nutritional changes, anemia, and metabolic shifts. On its own, fatigue rarely points to one diagnosis, but fatigue plus weight loss, digestive changes, persistent pain, or jaundice-related signs, that combination matters. Why people miss it? Because fatigue is the default emotion of modern life. People blame stress, work, screens, aging, and sometimes they're right. But when fatigue is new, persistent, and paired with other signals, it deserves evaluation. What to do next? Start simple. Clinician visit and baseline labs can rule out common causes quickly. The main mistake is waiting months because fatigue feels too vague to mention. It isn't vague to your body. It's often the first sign that something changed.